Mississauga-Streetsville.
Well, thank you, Speaker. My question is for the Minister of Health and Long-Term Care. During the past 2 weeks, there have been reports of a shortage of injectable drugs used by Ontario's healthcare providers. Ontario has a responsibility to ensure that patients get access to the essential care they need throughout our healthcare system. Ontarians expect our Ministry of Health and Long-Term Care to take action and to address the
member from
urgency of the
Northumberland will come to order.
Of critical drugs. Would the minister inform people in neighbourhoods like Lisgar, Meadowvale and Streetsville what Ontario is doing to address the underlying issues arising from the shortage of drugs caused by one specific drug company?
Thank you. Minister of Health.
Well, thank you, Speaker, and I'd like to thank the member for the question. First of all, I think it's important to indicate to this House that there have been no reported cancellations or delays of surgery in Ontario's publicly funded hospitals, Speaker. On March the 6th, I did write to the Federal Minister of Health, Speaker, asking to make it mandatory for companies to report shortages. The House of Commons subsequently passed an NDP motion to do this on March 14th. On March 7th, I publicly detailed our action plan to address issues arising from the shortage. That includes an assessment of the inventory of drugs across Ontario, Speaker, a redistribution plan to move available supplies of drugs across the province to where they are needed the most, provincial coordination of the procurement of affected drugs, a plan for service delivery in the event of drug shortages, and ongoing communications with the healthcare sector, Speaker.
Thank you. Supplementary.
Well, thank you, Speaker. I understand there's been communication with other provincial and territorial partners regarding this shortage, which affects all of North America. Patient care is Ontario's top priority. This situation gives rise to additional questions regarding the roles and the responsibilities of all those involved, including Ontario's healthcare providers, such as hospitals, long-term care homes and hospices, all provinces and territories, the federal government, and drug manufacturers and suppliers. Minister, how are the province, our agencies and our healthcare partners collaborating to resolve this drug shortage?
Minister of Health.
Well, Speaker, let me begin by saying that Ontario's healthcare community has really risen to the challenge and are working together in a very, very collaborative way to ensure that patients do get the drugs that they need. Speaker, this is an issue that involves many healthcare partners. Drug manufacturers and suppliers produce the drugs in response to healthcare system requirements. The manufacturing and supply of drugs must be licensed by Health Canada. The federal government has standards through federal legislation and regulations to ensure safe and effective drugs and health products. Hospitals and other care providers purchase drugs and other pharmaceutical products through purchasing organizations. These organizations seek out sources for the drugs from federally licensed providers. LHINs, Speaker, play an important role in managing emergencies. They work with the local health providers and community members to determine the health priorities of each riding. My ministry works with all of these organizations.